Hi, I'm Dr. Amodio. I'm one of the cardiac surgeons at UHealth here in Miami, and I specialize in aortic surgery and complex adult congenital and redo surgery, reintervention surgeries. My clinical focus is mostly aortic pathologies, and that seeing aortic cases every day really fostered my passion for aortic surgery. And then I see really the difficulties that some of these patients have to get their pathology treated, and they travel from one center to the other until they finally find a place to have these high-risk surgeries. So young adults, they might have a congenital condition like bicuspid aortic valve. They are very scared of taking medications. So what comes into place is to focus on how to repair those valves and how to address the aortic disease without changing much their life. So one of the guidance I would give young adults living with aortic disease is to check your blood pressure and talk to your cardiologist. Be referred early to a center where we can treat this pathology as a whole. You need to have a center where from the nurses and the anesthesia team and perfusionist team are all together, and they're able to follow you up and give you the best care in the post-operative and plan for the future in case you need the next step or a future operation.